Why do grown-ups get ear infection? Infection in the ear aren't popular with adults the way they are with kids, but they stand to be more severe. In adults, infection in the ear symptoms ought to be seriously monitored as well as diagnosed by a medical professional so as to forestall any complications from happening. Specific actions and situations increases the chances of some persons having infection in ear compared to others. Nevertheless, there are a couple of significant steps that could be taken to ensure prevention as well as treatment. In this article you will be learning more about these prevention and treatment techniques. Symptoms. One part of our body that looks very complicated is the ear. It comprised various chambers. Ear infections could occur in any of the chambers, resulting to different symptoms. The ear has three main parts and they are inner ear, middle ear, and outer ear. Of these three, the most common place for infections are the middle and outer ear. Infections in the inner ear are not so common, most times they end up being a sign of some other hidden conditions. Adult infection in ear symptom differ depending on their location and could include inflammations well as pain, hearing changes, tenderness to the touch, vomiting, nausea, fever, dizziness, headache, swollen ear. Ear discharge in any form is indicative or a more severe issue which should be ascertained by a medical doctor immediately. Middle ear infections. This is the area that is directly at the back of the eardrum. Viruses or bacteria from the eyes, nasal passages and mouth that are trapped at the back of the eardrum are responsible for the infections in the middle ear. The resulting feeling is that of pain and plugged ear sensation. Some people could have difficulty hearing, because an eardrum that is inflamed is not as functional as expected regarding sounds. There is equally an amassing of pus or fluid at the back of the eardrum, making it difficult to hear. The individual gets the feeling ear that has been affected as beneath water. When the eardrum bursts or tears due to pressure buildup from infection in the ear, fluid could drain from that ear. General tiredness as well as a fever could equally be associated with infections in the middle ear. Outer ear infections. The external ear, which is the outer ear, is an extension of the ear canal found on the eardrum outer part which connects to the ear outer opening. An outer infection could begin with a rash that itches on the ear outer part. The dark, warm ear canal appears to be where germs reside and give birth to outer ear infection. Ear irritations and injuries caused by foreign objects like fingernails or cotton swabs can also cause outer-based ear infections. The common symptoms are a painful ear canal or ear, tender when touched and swollen. Causes as well as risk factors. Ear infections experienced by adults are usually prompted by germs like bacteria, fungus or viruses. The manner of infection faced by any individual is normally determined by how that individual got infected. Those who have immune systems that have been weakened or ear inflammation are more at risk to have these infection in ear compared to others. Another risk factor worth considering is diabetes. People who have chronic skin irritations like psoriasis or eczema have a higher chance of having outer kind of skin infections too. Middle ear infections. Flu as well as allergies could cause middle ear infection. Other respiratory challenges like throat infections or sinus could be responsible for middle ear infection, the moment the bacteria can pass via the connected passage to the eustachian tube. Eustachian tubes normally connect the ear to throat and nose and are known for controlling the ear pressure. They can be easily targeted by germs because of their position. People who smoke or are around smoke may also be more likely to get middle ear infections. Individuals who are fond of smoking or hang around smoke are like to end up with middle ear infection. Outer ear infections. A very popular infection for outer ear is called swimmer's ear. Those who spend considerable time in water are highly prone to having this sort of infection in their outer ear. Water that stays inside the ear canal post-bathing or swimming creates the ideal environment for germs. That is why infection of the outer ear is mostly caused by untreated water. When to visit a doctor. Experiencing a minor ache in your ear is not something that should give you sleepless nights because infection in the ear symptom normally go away without any treatments. One definitely needs to see a doctor if infection in ear symptoms do not improve in a 3-day period. If other new symptoms emerge like dizziness or fever, you are advised to see a doctor quick. The slightest sign of ear discharge should equally worth seeing the doctor. Diagnosis. An individual's medical history will be helpful to a doctor in carrying out their diagnosis. They are going to ask for any symptoms which may have occurred along any possible medications within the process. The doctors could employ the use of otoscope for observing the ear canal and eardrum for symptoms of infection. This process may be followed by small puffs of air. The doctor will want to know how the eardrum behaves when its air is pushed against it. This is helpful in middle ear infection diagnosis. Treatment. Based on what the cause is, some infections normally clear up after a short while. Symptoms could be managed within this period, and a medical doctor could suggest other treatments just to fast-track the process of healing. Antibiotics and other prescriptions. Based on a CDC statement, employing the use of antibiotics through the mouth for treating infection in the ear might not be that effective concerning outer and middle ear infections. Antibiotics are not effective against ear infections caused by viruses. Treatment is determined by the cause as well as the seriousness of the said infection, and other health challenges someone might be having. Some doctors recommend prescription ear drops for treatment. These ear drops are equally useful in treating pain symptoms occasionally. Over-the-counter medications. Drugs like ibuprofen and acetaminophen have helped several adults who have ear infections in the area of treating the pains that come with such inflammation. Advil and Tylenol are available for purchase online, along with other brands too. Decongestants like pseudoephedrine or diphenhydramine might equally help in relieving some symptoms, particularly those that are caused by too much mucus within the eustachian tubes. Antihistamines and decongestants are equally available for purchase online and on the counter. Drugs like these might help in getting rid of the pains associated with the infection, but they cannot make the infection go away. Home remedies. Eardrops. Non-prescription eardrops might be helpful regarding treatment for swimmer ear that aren't that severe. Eardrops can be bought over the counter or made at domestically. Based on ear experts, a simple domestic blend can easily be made just by mixing half rubbing alcohol along with half white vinegar. Applying few drops on the ears could assist in making the ear canal to be dry and enhance the process of healing. The drops are not to be used with persons that have ear tubes, specific ear surgeries, or permanent eardrum injuries. If an individual is using these drops and the situation is not improving, such person should see a doctor as soon as possible. Eardrops shouldn't be applied in any ear that is having discharge, unless of course, it has been specifically prescribed by a medical doctor. Ear drainage, discharge or even blood is indicative of a more serious complication like an eardrum that has been ruptured that needs an urgent medical help. Compress. A slight and warm compress might help in relieving the pressure that builds up inside the ear too. Applying a warm compress for like 20 minutes while relaxing could help to alleviate the pains. Also, it is possible to use this with other pain treatments like over-the-counter drugs. Prevention. Many everyday steps can help in preventing several ear infections. Some regular hygiene tips as well as lifestyle choices do support prevention as well. It also generates inflammation. Stopping smoking is one significant step in avoiding ear and upper respiratory infections. Smoking explicitly attacks the soft tissues in this section of our bodies, and also reducing the efficacy of the body immune system. Always clean the outer ear and keep it dry after bathing or swimming. Experts suggest using earplugs in order to prevent water from entering into the ears. Using towel to dry and blot the ears after a swim could equally be helpful. Desist from using objects like cotton swabs for cleaning the ear because they can cause injury to their eardrum and ear canal. Washing your hands regularly can aid in preventing the spreading of germs which are capable of causing ear infections. Learn how not to put your fingers inside your ears or close to them. Those who have allergies should avoid whatever triggers their allergies so as to reduce any possible inflammation as well as mucus concentration that could cause an infection. Treat both skin conditions and seasonal allergies, as that could help in preventing these ear infections. Outlook. Adult infection in the ear could result in some severe consequences like hearing loss when it's not checked properly. An infection that is not treated could equally spread onto other body parts. A medical doctor should have you diagnosed should you suspect any ear infection. Those who experience ear infections recurrently should try and see an ear expert. A medical doctor guide can aid an individual in relieving their symptoms as well as treating the infection and taking practical steps to stop the infection reoccurring.